начинается.
Dear viewers, welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well with your friends, family, and your patients. Dear viewers, today's topic is Miracle of Ilizarov, First Impression, Plans, and Prospects. And the speaker is from Uzbekistan. I will introduce him later part of our program. With three, I'd like to request Professor Mofakhkharul Bari sir to join with us. Sir, please.
Everyone, thank you very much, Tanvir.
Thank you very much, sir, for joining with us. Dear viewers, we have another learned academic expert from Kurdistan, Iraq, that is Professor Omar Barabi, sir. I would like to request Professor Omar, sir, to join with us.
For everyone, good afternoon. Happy Friday. Thank you.
Good afternoon, sir. Happy Friday. Dear viewers, we have another enthusiastic Ilizarov surgeon from Patna, India, that is Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir. Would you please join with us, sir?
Thank you, Dr. Tanvir. Good afternoon, everybody, and greetings from India.
Thank you very much, sir. Dear viewers, we have another academic expert as well as our presenter, that is Professor Novikov, sir, and we have the speaker today, that is Dr. Mirzamurodov from Uzbekistan. I would like to request Dr. Mirzamurodov, sir, and Dr. Novikov, sir, to start the presentation. Sir, would you please start your presentation and share your screen, sir?
Good afternoon, everybody. Добрый день. And I want to introduce, I can say, our future. Future of Ilizarov, new page of our methods. Young doctor from Uzbekistan, from Islamic country, doctor who changed his life in the job with Ilizarov. Dr. Mirzamurodov today will show first his experience in our center and his experience with Ilizarov Ray. Please, Dr. Mirzamurodov.
Good afternoon. Thank you very much. I am Khalimovich Mirzamurodov. I work as an assistant at the Department of Traumatology and Neurosurgery of the Bukhara State Medical Institute. In today's presentation, I will talk about myself and the wonderful Ilizarov method. This is the world famous center of Ilizarov. In 2021, I first come to this center in connection with a conference to the 100th anniversary of Ilizarov. For 2 weeks, we participated in many operations, listened to lectures by professors. In this center, I meet my teacher, Professor Dr. Novikov Konstantin. I invited Dr. Novikov to Bukhara to develop this direction. In February 2022, in connection with the visit of Dr. Novikov to Bukhara, an extraordinary meeting of the Society of Traumatologists and Orthopedists of the Republic of Uzbekistan was held. At this conference, the professor shared his skill with his Uzbek colleagues. Together with Dr. Novikov, we first practiced limb lengthening in Bukhara. In addition, in May 2022, we held the first international seminar on the topic achievements of the Ilizarov method in traumatology and orthopedics. In turn, Dr. Novikov was very helpful in organizing this seminar. Dr. Bari, one of the orthopedists who made a great contribution to the development of the Ilizarov method around the world, also took part in this seminar. Sorry, I don't speak English well. If you allow me to continue in Russian, my teacher, Dr. Novikov, will help me with the translation.
And just now, dear colleagues, Dr. Mirzamurodov better speak English than Russian, because new generation in Uzbekistan speak not on the Russian language. And during same time, in Samarkand, very interesting international conference invite us, and there Dr. Professor Bari, me, and Dr. Professor Khajena from Tashkent has a very good presentation. And then with organized committee, we have planned for future each year go and there and show our experience with Ilizarov regeneration, because this is conference was for radiologists, and without X-ray any Ilizarov doctor cannot get normal result.
Это все знают, наш чудесный Илизаров центр после столько событий, этот наш учитель, доктор Новиков, мне приглашал научить еще больше изучать этот метод. Я сам хотел, и в этом году, в мае, я пришел к трехмесячному курсу в Илизаровском центре. И
And very interesting situation. We have education program in our center, and many doctors from all of the world come for study and for increase his experience with our technique. And nobody come immediately second time. And only this doctor who second time from short period come here and stay so big period.
Вот здесь видно, мы начали работать вместе с доктором Новиковым. Он мне научил много чего теоретически и практически, все знания. Мы работали совместно с Тюменским государственным медицинским институтом. Там был много лекций, я участвовал там. И еще мы начали в практичной работе. И еще один вещь сказать надо. Из Тюменского института очень большой помощь у нас этот Сергеев Константин Сергеевич, заведующий кафедрой травматологии и ортопедии, насчет лекций, насчет теоретических знаний, он нам очень много знаний дал.
And during this visit, from first step, from first day, very close, Mirzamurodov worked with our doctor, with medical university from Tyumen, because our cathedra from Tyumen in our center, and Professor Sergeyev Konstantin Sergeyevich give us very good support. And there too, you can see here Dr. Intuming listening our lecture, and then during the time in operation theater, you can see from beginning our young doctor start work immediately like surgeon with his hand. With my experience from beginning, he worked and to do surgery with very difficult case.
Теперь мы начинаем о пациентов. До этого времени мы думали, такие сложные больные невозможно лечить простым путем и невозможно легче будет о нем. Это мы думали, это большие операции, большие риски думали, но оказывается, я изучал метод Илизарова, знал, что с методом Илизаровым очень тяжелым пациентам можно просто полечить, легче, больным тоже легче будет, они тоже сразу наступают. Это, кратко сказано, это чудо. Вот наш первый шаг, наш первый пациент, этот пациент Нурмуродова Гульрух, у него 30 лет, он из Бухары, этот наш первый пациентка, мы впервые эту операцию сделали, у него диагноз вальгусоторсионная деформация коленных суставов. У него низкий рост, у него рост 115 сантиметров был. Но она обращалась многим врачам из Турции, из Узбекистана, из Ташкента. Но все как-то ему не понравился их предложение. Потом она обращалась ко мне, и мы сделали его операцию. Вот из рентгена видно, что какие результаты. Вот у нас ноги прямые стали. Но на следующий этап в сентябре вторую ногу сделаем. Ну, хороший результат.
And just now, Dr. Mirzamurodov want to show his clinical examples. This is first case from Uzbekistan. This surgery was done in the May, and this is young girl Gulruh with low height, with severe valgus and torsion deformity. She consulting in Turkey, in Uzbekistan, in Tashkent, with so many doctors, and his proposed surgery for another technique. She was not ready. So many doctors not touch her because in Uzbekistan this is case for treatment very heavy. And after surgery, Dr. Mirzamurodov for next day start understand what he need do on the next day, how support patient with dressing, with activities, with physiotherapy, and he haven't any knowledge, he haven't any skills in this area, and this is the reason why he immediately make plan, go for teaching everything from surgery till remove of frame, must teaching in the original in Kurgan.
Ну, следующий пациент, ну, этот пациент уже мы лечили в центр Илизарова. Этот пациент, диагноз антикурвационная деформация левого бедра, ахондроплазия, низкий рост, состояние послеоперативного лечения, удлинение бедер и голени. Но этот пациент лечился до этого времени в разных городах, в Москве лечился и других. Они с наружной фиксацией, с стержневым аппаратом удлинение сделали. Как вы видите, этот процесс они проводили во время ковида в дома. Они удлинили много из нормы. После снятия аппарата у нее появится перелом.
And just now, another case with achondroplasia, short stature, and this case come for us from another city. He take treatment in Moscow, but I think in St. Petersburg too. And during the pandemic with COVID, all of procedure with lengthening was done in home with mother. And you see, doctor, left side regeneration and right side. We have here picture like sandwich. And during the treatment, this is sandwich formation, step by step, slowly. I think during more than 1 month, and during this period, a patient no contact with his doctor. And on the end, we have a problem. And why this is patient come for us? Because another doctor propose put inside for both of, including left femur and right femur, intramedullary nail. After remove of device, for safe of result, doctor has plan put on nail, and mother not agree with this plan, find us, and you can see X-ray picture, and just now we cannot see clear pelvis because here severe hyperlordosis, because knee joint has extra unbending position, and after remove of frame immediately coming fracture, and then
мы проводили операцию остеосинтез аппаратом наружной фиксации левого бедра, остеотомия бедренной кости на вершине деформации. Но, как видно, исправить с методом Илизаровым такие проблемы очень легко. Мы его поставили аппарат Илизарова и, как видно, убрали деформацию, но проблемы остались сзади.
And with our surgery, Dr. Mirzamurodov told very easy, very quickly we can correct deformity, stabilize the area of fracture, and just now patient ready for discharge from clinic, from hospital.
Ну, следующий пациент, у него 6 лет, очень тяжелая болезнь, очень много встречается такие больные, врожденные ложные суставы левой голени. Ну, антикурвационно-варусная деформация левой голени 90 градусов. Но такими больными в многих стран на стандарту сделать надо ампутацию. Но мы на этот против, мы хотели оставить его ногу и как-то помогать его.
And another case from our department with congenital pseudoarthrosis with deformity, anticurvation, varus deformity, and this baby never work. You can see osteoporosis, and in many countries, including Russia, Uzbekistan, and Europe, gold standard for treatment this category of patients, amputation. But our doctor, our center, our department try support, save these extremities and start treat her with Ilizarov methods.
Ну, этот пациента оперировали другие врачи. У меня очень большой урок был этот. Но когда у нас поступают такие больные, мы тоже не знаем, какие методы выбрать. Может быть, поставить пластину, может быть, интрамедулярный что-нибудь спицы. Но как-то мы не знали на это. Но здесь тоже она поступила сперва на другого врача. Они сделали аппарат. Но когда мне научил доктор Novikov, я понял, что когда надо исправить деформацию, надо шарнирное устройство поставить на вершине, на уровне деформации. Вот здесь всем видно, что шарниры неправильно поставлены. Но сейчас я еще следующий слайд покажу. Они после операции начали убрать эту деформацию, начали коррекцию, но никакого толка не было. Ну, вот здесь на прямом проекте тоже видно, но вместо деформации внизу, шарниры поставлены наверху. Вот в боковом проекте тоже видно, вот шарниры вообще-то в неправильном месте поставлены.
And this is case for Dr. Mirzamurodov was a great school, because in his country, in his department, usually they think about plate, about intermediary nail, and usually in his clinic not touch this patient. And when he first time saw of this baby, next day during 3 weeks after surgery, and check X-rays, and all time we haven't result of correction. And just now Dr. Mirzamurodov understand why we so many time spent for teaching of rule of our methods, where we need put hinge, where level of correction, where apex of deformity, and all of our device must be work like one team. And on the left X-rays we can see how hinges was only on the different level. On the right X-rays too, during 3 weeks we haven't any result with correction.
Но в этой картинке показано после операции 20 дни. Но здесь, что видно, здесь тоже я показал, здесь вместо деформации, а шарниры чуть-чуть выше ставлены вот в боковом проекте. Но заметно, что на 20 дней столько коррекций сделали, столько крутили стержнем, но деформацию не убрали, как-то не справились с этим. Ну, потом этот пациент к нам обращались, и с доктором Новиковым мы вторую операцию сделали, но во втором...
And during 20 days correction, after this X-rays, mother talk with doctor, doctor make a small consilium, and we haven't result of correction, and you can see why. And then we go to the operation theater and to do second surgery.
Вот здесь показано после второй операции состояние. Вот видно, что место деформации вот здесь был. Мы убрали в прямом проекции, тоже в боковом проекции деформация убрали. Вот шарниры поставлены. Вот здесь и здесь мы еще компрессию дали. Ну, сейчас еще компрессию даем. Ну, это еще в продолжении будет лечение.
And after second surgery, you can see result of correction. Axis is good, AP position, lateral position. We achieved correction of severe varus and anticurvation deformity. And just now we have planned for compression area on the end of tibia. And then we have planned discharge her to home.
Следующий пациент, 2008 год, у него диагноз врожденная аномалия развития, ахондроплазия, низкий рост, состояние послеоперативного лечения по Илизарову, удлинение голени и плеч. Но у него тоже операции проводили на других городах, но сейчас мы покажем кое-какие случаи. Но эта картина показана, этот пациент, когда поступал нам, вот этом состоянии было.
And just now, Dr. Mirzamurodov want to show another case with achondroplasia, 13 years old girl. This is X-ray picture on the admission day. She has discrepancy, right extremities, lower extremities short, no near 5 centimeters, valgus deformity, torsion, and she limping.
Ну, вот здесь показано у него в процессе, когда удлинение сделали в бедрах, но закончили удлинение после, в Москве сделали эту операцию, после удаления аппарата у него в правом бедре перелом появился. Но они...
And just now we show her X-ray. She finished lengthening on the another city, maybe in Moscow, I don't know. And after removal of frame, immediately inside of plaster broken the femur.
Ну, после проявления перелома вот поставлена экстрамедулярный остеосинтез, там пластину поставили. Но как-то рычаг короткий и еще деформация тоже не убрали, но нормальной репозиции не сделали. Ну, это первая операция была после перелома. Но когда не заживлял, потом второй раз еще убрали пластину, другую пластину поставили, и здесь остеотомия сделали, и укорочение сделали.
And doctor from Saratov put on plate, and with this plate we cannot correct varus deformity, anticurvation deformity. Baby cannot walk. She has severe pain area of the plate, and then with mother go to the Moscow. Re-osteosynthesis, doctor from Moscow make correction with shortening, with triangle osteotomy, remove of some part of bone, put on another extramedullary plate, near half year fixation with plaster cast, and then with valgus and shortening she come for us.
Но когда к нам поступила больная, у нее на правом ноге очень большое укорочение, и еще в коленном суставе девиация 33 был. Но вот видно, после нашей операции мы сделали коррекцию деформации, убрали деформацию. Вот здесь видно, у нее девиация уменьшился до 9. Но вот здесь очень ярко видно, что удлинение тоже у нас получилось. В один момент мы удаляли укорочение и еще исправили деформацию.
And usually when this patient come, we remove all part of problem. She come with shortening with severe deviation of mechanical axis and more than 30 centimeters. Just now near the normal, 9 millimeters. And then we correct valgus deformity tibia finished, and just now continued only lengthening, and we will remove during short period shortening of femur.
Еще один интересный случай. Больной 2010 года, у него нарушение плотности костей, антикурвационная деформация левого бедра, состояние после операции. Но ребенок в дома уже почти снятый аппарата, но он прыгал из лестницы и упал. Но после этого у него появился перелом, но там в местные стационары вот такой виде отправили к нам. Вот, они даже как-то не знали, как фиксируют и иммобилизацию сделать.
And another interesting case, this is a patient with valgus deformity. After correction of valgus deformity on tibia, on femur, and before coming for removal of frame, she jumped on the stairs and fall down and broken area of the wire here. And this is sometimes happened. Baby is baby, but doctor from another area, from Ufa, don't know how can help. And you can see one leg with bandages fixed with the leg on the frame, and doctor don't know how with Ilizarov frame then they can support with in operation theater, for example. And on this condition she come in our department.
Ну, вот здесь можно сказать, почему мы все любим методы Илизарова. Потому что кто знает метод Илизарова, но у него это очень легко. Если в других случаях будет такой перелом, мы убираем аппарат и какую-нибудь пластину поставим, или интрамедулярный, или экстрамедулярный, фиксации постараемся этот заживлять перелома. Но здесь мы никакого трудности не было, но кое-какие детали добавляли, 2 спицы и 2 стержня добавляли, и все, проблемы убрали. Вот здесь показано место перелома. Но вы видели, какой перелом был, какой деформация был. Ну, через 15-20 минутной операции вот такой результат у нас.
And why we just now he so like and love our methods? Because if we have a case with fracture, usually doctor remove of Ilizarov device, then put on or intramedullary nail or another extramedullary plate, open surgery, so many hours. And here, doctor who know our technique very well, during 15-20 minutes, we put few wires, and here mix with half pins with chance. After 20 minutes, we have perfect reduction.
Ну, здесь тоже очень тяжелая болезнь, врожденная аномалия развития верхней и нижней конечности, псевдоахондроплазия, многокомпонентные деформации бедер и голени. У нее состояние после операции, у нее провели удлинение бедер и голен, Но, как видно, у нее тоже после снятия аппарата появилась деформация. Ну, мы, как видно, исправили эти проблемы тоже с методом Илизаровым. Ну, коротко сказано, что с методом Илизаровым любой проблему можно удалять.
And in other case with pseudoachondroplasia, very difficult case for any orthopedist for surgery, and usually doctor not touch this patient. Few months ago we start support this guy, and she fall down, has fracture. We again put on frame, and just now he walk, and we operate another tibia for lengthening, because after first stage we increase his height and correct deformity, and just now he more than 8 centimeters higher than before surgery.
Но вот здесь многие сделают такие ошибки, но вот видно, что после экстрамедулярной или интрамедулярной остеосинтеза появляется такой случай у каждого травматолога или у каждого ортопеда, такая проблема будет. Но здесь видно, что после фиксации, после остеосинтеза, но деформация осталась и не заживлялась ложный сустав. Но после к нам поступления мы убрали пластину и поставили аппарат Илизарова.
And I think without translate, any doctor can understand. Any traumatologist and orthopedics have this case after fracture, put on extramedullary plate, and then coming time when having healing, enough consolidation, and coming pseudoarthrosis, and doctor usually put another plate, put on extramedullary nail. We remove this plate and apply of our frame, and just now everything in our hand. This is picture a few days after surgery, and just now this is patient out of department. She stay at home, and we wait when will come in consolidation.
Ну, следующий случай, диагноз ложный сустав левой локтевой кости, нестабильный накосный остеосинтез локтевой кости. Вот здесь тоже мы убрали пластину и поставили аппарат Илизарова.
Absolutely same situation, only another segment, forearm with plate. We haven't healing, and just now we remove a plate, put on Ilizarov device, and absolutely sure here we will get result.
Ну, здесь тоже такая проблема с экстрамедулярным остеосинтезом, не заживлялись, и потом мы убрали пластину и поставили аппарат Илизарова. Уже когда выписка, уже у нее появляется как-то регенерат, но хороший результат.
Another area of forearm, another pseudoarthrosis, another plate, another same procedure. Remove of reason for pseudoarthrosis, and just now I think magic Ilizarov, magic effect of Ilizarov will help of this patient.
Здесь тоже пациент с ахондроплазией, низкий рост. Мы у нее удлиняли плечи, но вот такой результат. Еще продолжается дистракцию, еще не закончились, но уже, как видно, здесь появлялись регенераты. Очень хорошая операция, очень хорошие результаты.
And another patient with achondroplasia, third stage, she come from another city. We will not talk about why, but now we support with double osteotomy of each humerus. And we operate not simultaneous. First, we start from left humerus. After that, after 10 days, we start another humerus. And why we did in low part of humerus osteotomy? Because she has before not full unbending, and this reason why we do this. And for Dr. Mirzamurodov, any case was first time in his life. And I can talk most of this patient, he operate with his hand.
Ну, здесь тоже пациент, врожденная деформация правой кисти, укорочение правого предплечья, трехпалая расщепленная правая кисть, аплазия малоберцовой кости. Здесь много раз операции сделали, удлинение сделали, но когда к нам поступал, у него очень большая вальгусная деформация коленного сустава. Мы проводили у него операции, сделали остеотомию из верхнего третьего большеберцовой кости.
And another patient with aplasia of fibula, with problem of hand, with so many surgeries, and just now we support him with correction of valgus deformity, with discrepancy, and he on the way. After a few days he will go to the home.
Еще здесь необычный случай, но у каждого ортопеда не будет такой случай. Пациенту почти 74 года, у него деформация правой стопы, последствия травмы. Она получила травму 20 лет назад, но сейчас он не может ходить, у него мучает очень сильные боли, поэтому обращался к нам. Мы и его сделали операцию. Вот, мы поставили аппарат Илизарова и сделали остеотомию малоберцовой и большеберцовой костей и дистального участка. Но сейчас во время лечения мы только что начали коррекцию деформации.
And another case, very interesting and I think very difficult and very strange. Why? Because patient 74 years old woman, and trauma was 20 years ago, and just now she cannot work, and she has so many problems with cardiologist, with endocrinologist. She took more than 40 years hormones. She has osteoporosis, but after, step by step she lost mobilities. And if doctor orthopedist not support her, she will die, because problem will increase with heart, with lungs, and this is support for continued life. Difficult, risky, but I think this is, we will get result, and after a few weeks, few months, we will show her. She walk, and today in front of us she walk outside of ward, and this is our mistake. We not prepare a picture when she walk, and already we start correction, and she just now, like young patient, she won't continue with life. This reason for Magic Ilizarov why we touch so adult patient.
Пациенту 20 лет, у него укорочение правого предплечья 6 сантиметров, лучевой косорукус правого предплечья. Но наша пациентка, это второй пациент из Узбекистана, мы начали его удлинять из голени, мы поставили аппарат, Уже правые голени мы начали удлинять, левые ноги только что после операционного состояния. Очень хороший, очень чудесный метод. После таких операций на других методах невозможно на другой день ходить. А на этот операция, после операции, тот день, когда проводила операцию утром, уже вечером ребенок ходит, ничего не беспокоит. Ну,
Another case with achondroplasia, another case from Uzbekistan, she come here and one leg, then another leg, we operate her. And this is a wonderful magical method when patient after surgery, same day, after few hours, stand up and walk. In other methods, any in other methods, patient cannot use legs after surgery so quickly. And this baby surgery, second surgery was yesterday. Yesterday, baby start walk, and when doctor asked her how she feel, and she smiled. And father, after discharge, will continue this procedure at home. And Dr. Mirzamurodov, after a few days, will back to the Bukhara, and then will support this patient there in the Uzbekistan.
Но очень много встречающий диагноз варусно-торсионная деформация обеих голеней. Очень простой, очень быстрый и очень хороший результат сразу после операции такие больные.
Here you can see very often we met any orthopedist when small varus deformity, but severe torsion deformity, more than 40, near 50-degree torsion deformity of baby has. And after surgery, we remove all part of problems in the operation theater. And already, same day, this is baby start work and loading of these extremities.
Спасибо вам всех, что прослушали за хорошую аудиторию. Ну, особенно спасибо Константину Игоревичу, такой мастер-классу, он дает мне такое знание. Я очень рад, что выбрал такое направление, выбрал такой метод. Я очень рад, что поступил в такой вебинаре. Спасибо вам всех. Приглашаю вам всех нашу чудесную Бухару. Но я думаю, вот такой чудесные методы, вот таким чудесным городом еще развитие очень большое будет. Ну, спасибо всем. Приглашаю всех в Бухару.
Please let me translate only some part of this last speech. And Dr. Mirzamurodov invite all of you to the Bukhara, and he absolutely sure our methods, Ilizarov medical magic methods will development, will support patient all of the world. And thank you very much for webinar, for organizer, for any who give possibilities for him stayed with you. Thank you very much.
Спасибо, thank you very much.
Thank you very much, Dr. Mirzamurodov, for your appreciating works. From Orthopaedic Solution Academy, I would like to say congratulations and welcome to the magical world of Ilizarov.
Thank you very much.
Now, I would like to request Professor Mofakhkharul Bari sir to say something regarding the journey of Dr. Mirzamurodov sir, please. Professor Mofakhkharul Bari sir, would you please unmute yourself?
Oh, yes. Okay. Now you can hear.
Okay. Yes,
Okay,
sir.
okay. So,
Okay, sir.
This was his paper presentation cases, very beautiful and difficult cases, starting femur, tibia, humerus, And so congenital deformities he has shown very nicely. Only problem was that whenever I have seen the pictures, I could understand everything in Russian, but it was difficult for other people, probably what I understood. But the cases was fantastic. How to treat all these difficult cases by Ilizarov technique, he has nicely shown. And by 2 months of this course, you have learned a lot of things. One very interesting thing, the congenital pseudoarthritis of tibia with procurvatum and anticurvatia 90-degree. Why you have not opened up that one? You have tried it gradually to correct the tibia and fibula non-union side. That was atrophic. Why you have taken that decision to go for gradual by Ilizarov? Why not by opening, and then you can correct the deformity in the same situation? Question to Novikov.
Just now I will explain him. Почему не открыли в первый раз, а почему сразу?
I cannot hear. Sound is very low.
Доктор Bari, здравствуйте.
Здравствуйте.
Этот пациентку сперва сделали другие врачи. Они выбрали такой метод, они думали, они только что делали остеотомию, не открыли там. Остеотомию сделали, они думали...
Да, я понял это, но...
Ну, второй операцию не сделали.
Хорошо.
First surgery with congenital pseudoarthrosis was... how Ilizarov say, closed.
Sound.
With small incision, and then on the second surgery we open tibia and make correction in front of our eyes. We open second surgery.
Okay. I understand. Thank you.
Thank you very much, sir. Now, I would like to request Professor Omar sir to say something regarding the presentation, sir. Professor Omar sir. Sir, you have to unmute yourself, sir.
Just a minute.
Yes.
Yes, sir. Professor Omar sir, please.
Hear me? And now? Do you hear me?
Yeah.
Okay. Regarding congenital seed arthrosis of tibia.
Properly, sir.
And now, regarding congenital seed arthrosis of tibia, what could be the role of zoledronic acid and bone morphogenic protein? And what could be the role of resection of hamartoma, as they have high chance of recurrence and refracturing? Okay, that's my comment.
Yeah, we reject a big part of proximal part of this fragment, and then we remove more than 1 centimeter on the distal part, and then we in the operation theater we put like dock inside, end of end.
I hope that there is no chance of refracturing. And usually I am using medical treatment also with these cases, zoledronic acid and bone morphogenic protein, to minimize chance of fracture, to minimize intraoperative bleeding, and to minimize post-operative pain. Thank you so much.
Yes, correct.
Thank you very much, sir, for giving us great informations and great tips. Now, I would like to request Dr. Shamsul Huda sir to say something regarding the presentation. Dr. Shamsul Huda sir, please.
Thank you, Dr. Tanvir. Thanks, Novikov sir, for displaying such wonderful cases. Wonderful cases of deformity correction and limb lengthening, especially in the pediatric ones. It has to be post-op followed very precisely. As Omar also said, that there has to be no refracture in these cases. We have to apply braces. Because of some sound issues, I don't have any questions or not, but that's what a wonderful presentation, sir.
Mm-hmm.
And Dr. Huda,
thank you.
And this is not in our hand because
Sound, again sound. Increase your voice.
Sound issue, sir.
just now.
Yes.
Perfect.
And with congenital pseudoarthrosis, sorry, everywhere in the world we have not refracture. This is program of growing this disease, and baby cannot grow normal bone. Only when coming 14, 16 years, then will consolidate. This period, we have patient who use Ilizarov frame so many months, so many years, start to jump, walk, and again fracture, then again fracture. Again we apply Ilizarov frame, but what we can do? Another choice, this is amputation. And we hope everything will good with this baby because mother believe us and we pray and we believe the magic of Ilizarov. But still, doctors around of the world haven't, including USA, haven't methods for support 100% for congenital pseudoarthrosis. We will get result, but for how many months, we don't know. Only Allah knows.
Yes. Regarding this, I want to add only. So you know the Professor Dror Pele, since today, from 2002, he has done 17 cases of his 17 cases of taken technique from Professor Choi from Korea.
Yeah.
Cross union, this is called cross union, or X union. By giving this, but he has shown that no refracture till today. We shall have to follow up that one. 100% union, even in Ilizarov we can get, but with Ilizarov we are getting refracture also. And at the same time, we must follow this zoledronic acid before surgery starting the Ilizarov or any other way. Now recently I was in India, in Pune, the one Sandeep Pathwardhan, he has shown some cases, the controversy. But with Ilizarov, you can go for lengthening, non-union, and other deformity correction also. But what he has shown in India, I have shown by putting a one nail through the calcaneum and giving the bone grafting, they are getting union. But regarding shorting and deformity, it is difficult too. So that's why I agree with you. You cannot draw any and 100% conclusive by pseudoarthrosis treatment, which way is better. So we are doing this Ilizarov with cross union also, zoledronic acid, BMP. Even then, problem persists. Okay?
You're absolutely right.
Thank you very much.
Any rates of recurrence of deformity? Just one quick question. Any rates of recurrence of deformity in pediatric cases when they grow up, sir? And what is the basic protocol, sir? Recurrence of deformity.
Deformities. See,
recurrence of deformity with growing age.
I am telling you, deformity, if in the lower 1/3 of tibia, it is very difficult to correct. I am telling you. In the middle, it's very easy to correct deformity. Even in upper, difficult. Lower 1/3, very difficult. So that's why, the process, what started from Ilizarov Center, Kurgan. Before that, Anderson, he has done 36 cases. You can see the literature. And most of the cases, he has gone for this amputation. Then, initial stage of Dror Pele's life, he also started doing this, by Ilizarov. I have seen his paper in 2002 in Patna. Shamsul Huda, you had not been there at that time. 2002, I was present there. Dror Pele was showing the cases not by this case, by cross union, by Ilizarov method. Union you can get, but refracture occurs in case of. So there is not absolutely protocol. What you will do, it depends on your cases. So lower 1/3 is very difficult to treat.
So I'm asking about the recurrence of deformity, sir.
Recurrence of deformity in pseudoarthrosis. In pseudoarthrosis, no. If you do go it properly, you cannot get the recurrence. You can only get the refracture.
And any role of, sir, internal fixation, lengthening nail, pediatric lengthening nail in these cases?
You can have, double telescopic I am also using. You can even rush nail, Ilizarov, you can do that. You can do with even rush nail with plate screw also, but it depends. Whenever you are getting neurofibromatosis, that is very difficult, I tell you. Pseudoarthrosis, Recklinghausen disease, it is very difficult to treat. Refracture occurs. Even then, no, Dorpella, he has shown 17 cases. You can see in the literature. He is telling all the time, demanding no fracture, no fracture. But time will show you. Since 2002, now 20 years, you should have to follow. Ilizarov, he is doing since 1970. Even they are getting good. A lot of cases they have shown till today. But refracture you will get. This is the disease of the bone. Whole periostome is damaged. So that's why the problem arises and problem persists. And you will get, even then we are getting good result with the Ilizarov technique without doing any kind of bone grafting. It depends on what type of case, what about the age of the patient. If you go for 2, 3 years, 4 years, difficult to treat the younger child, little 2 years, 3 years. If 5, 6, 7 years, it is very easy to treat the patient. Okay.
I am agree. Yeah.
Thank you.
Thank you. Spasiba.
Yes, sir. Thank you, sir.
Thank you so much.
Thank you very much, sir, for a nice discussion.
Habibjon, very good.
Спасибо.
Okay. Спасибо.
На следующий раз постараемся полностью английский прочитать.
Yeah, I would like to thank. Yeah.
Next Friday, what is the role of next Friday?
Thank you very much. And I would like to thank Raj TV and Melia CNT Specialist Hospital for sponsoring our program. Dear viewers, this is the end of our program today. Hope we will connect with you the coming Friday with another magical Ilizarov topic. Till then, I would like to say bye-bye to all of you. Bye-bye.
Goodbye. Thank you so much.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Tanvir, ভালো কেস ভালো দেখাইছে কিন্তু
জি স্যার
ভালো নেক্সট ফ্রাইডে কি করবা
ভালো স্যার নেক্সট ফ্রাইডে আপনি একটা করতে চাইছিলেন স্যার সেটা আমরা একটু করি স্যার
নেক্সট ফ্রাইডে না ঠিক আছে আমি তোমাকে তাহলে জানাচ্ছি ওই দিন টিউজডে কোন টপিক